Welcome everybody everywhere to join us to our 14th session of our joint webinar between Arab Public Health Association and Imperial College WHO Collaborating Center. Today's session, as a continuing of talking about COVID-19, we are talking about a very specific and very important issue, regardless COVID-19 or not. We are talking about the physical activity during COVID-19 and beyond COVID-19. Everybody knows that a physical activity is very important, and it has its impact about our quality of life. Physical activity, regardless age, time, and place, it's very important, and it is continually daily practice. So today, since we are talking about physical activity, also we must bear in mind that physical activity is important for our mental and health life. So today I will not talk much about it because we have a wonderful two speakers today, Dr. Fiona Bull and Dr. Mohammed Al-Kuwari, who will explore this issue today and will enrich our experience about physical activity, regardless during COVID-19 and beyond COVID-19, and how much it was important and still important during this pandemic. So I welcome the two speakers of today. Dr. Fiona, I don't know if she joined us or not, but okay. So our two speakers for today, unfortunately, Dr. Fiona did not join yet. We have Dr. Mohammed Al-Kuwari. Dr. Mohammed Al-Kuwari, let me introduce His Excellency. He is a senior consultant in preventive medicine, a primary care corporation at the Ministry of Public Health in Qatar. Dr. Al-Kuwari is a leading figure in physical health in the Gulf region and the Arab region. And he was the CEO of Hospital, which is the hospital, orthopedic and sport medicine hospital in Qatar. He is trained in community medicine and obtained a one-year fellowship at Imperial College in London. Let me welcome him today and tell Dr. Fiona joining us. We will introduce her more. Please, Dr. Al-Kuwari, I welcome you and give you the floor, give you the screen to explore your vast experience to us for our benefits. Thank you. Please.
Thank you, Dr. Nibal. Thank you, Professor Salman and Professor Khoja. And I welcome my colleague, Professor Fiona Bull. Actually, I would like to thank even people to address this important issue during the current pandemic of COVID-19. Which is really a vital public health issue for us as a public health profession, and even for other colleagues in healthcare, as well as some community leaders who are really taking care about the psychosocial life of the community. So my presentation really will focus on our situation as a physical activity promoter and as people who are supervising a surveillance for physical inactivity during the normal situation and with changing role, because a lot of public health practitioners and other healthcare professionals, they changed their role during the COVID-19 pandemic. The priorities for even the public health agenda has been changed with the COVID-19 situation. So I could describe the situation as we are dealing with two pandemics at the same time. And I think this situation will be clear with my colleague, Professor Fiona Bull, when she is dealing with two pandemics at the same time. So I will just put my presentation to focus on this problem, and I just check if everybody could see my presentation.
Yes, it's seen.
Okay, so as I described, that we are really dealing with two pandemics at the same time. So my presentation will focus on the physical inactivity pandemic and COVID-19 pandemic, and how they have the similarity and differences and different sometimes strategies at the same time, and how we could deal with this situation. Why physical activity is important during COVID-19 pandemic? Is it in our public health agenda? Do we put it as a priority while we are keeping people safe from the infection? And how about our efforts to continue to study the epidemiology of physical inactivity and the change in behavior, as well as the intervention during the COVID-19 pandemic? And this is very important, really, lessons to learn from this pandemic. So just as you know, introduction for physical inactivity pandemic, which is really during the last 20 years, WHO and other really influencer from different specialties, even outside the healthcare, they try to bring the attention for the physical inactivity as a public health problem. So it's clear that even the high income countries, they are really suffering from this problem, and this linked more with the modernization of the life. Also, how we study the differences and health inequality in terms of the geographic and age group, as well as the gender. So we could see here that the females in certain areas, they are really affected by physical inactivities. WHO, they put really a 4 area for action, and this is really important to highlight how they stress on different intervention from different levels. I will stress about the importance of having supportive environment and supportive society, as well, having active people, and how the accessibility to the services, and even providing a very supportive environment to the physical activity is so important when we promote physical activity. And also they stress on the integrated recommendation for physical activity. It's not about only to increase your physical activity level, it's about even to reduce your sedentary behavior and to take care about your sleep quality. So I will just highlight the two things. With our current guidelines, we have really integrated approach for the guidelines. And we could see it's totally different from age group to another. So it's always to promote the minimum level of physical activity that really enhance your health. And it's coming from different angles, starting from reducing your sedentary behavior and improving your sleep, as well as taking the type of exercise which is really matched with your needs. So let's see another even situation for having supportive environment. Here, a good work. I have participated for some time with this work done for the Global Matrix, for the report card for the physical activity in children. And now this work really is becoming really expanded to have more countries. When we start with 15 countries. Right now we have almost more than 50 countries participating in the 4th card. But see here, how Zimbabwe, Nigeria, and certain African countries, they could really achieve active level for the children just through the active transportation, which will be affected heavily during our current situation. So active transportation is really a vital thing for those children in these countries. So what physical activity means in our life, and this is really an important thing. So for this old adult, this means sometimes a treatment for him. And he needs a lot of really access to supervised group exercise therapy. And this is what we try to promote through our initiative for exercise medicine. So how about the children? It's a part of their normal development. So this child has a physical education in the school, and he has the access to have active play for his life. How about the health professionals and all the professionals? They use the physical activity as a sport and as a stress management tool. So even for a prevention for their fitness. So physical activity has really different meaning in our life. For having a new emerging pandemic, which really comes from our memories when we read about the influenza pandemic 100 years ago. We couldn't imagine how the people's life will be changed and how the risk will increase for certain vulnerable group. But we are really seeing this now with this pandemic, which is for our generation is something new when we practice our public health. So it has the common preventive strategy. So social distancing, self-isolation and quarantine, wearing masks will be the important main strategy for controlling this pandemic and reducing the mortality. So with staying at home and staying safe for your health, we are really having some closure in certain important services that we provided for people. And we have some limited access even for the public transportation. So how about even the new strategy for work at home, study at home? And this is really interfering with all the agenda I just addressed for the physical activity in our life. Long screen time, when we remember about the integrated recommendation, we will see that we are affecting other angle for being active. The long screen time, irregular sleep pattern, and it could be worse when we don't have the healthy diet. How about our colleagues in healthcare? So we have really facing increase in the workload, which means that even our stress management tool, we couldn't really practice it very well during this pandemic. So this is the life after we face the COVID-19 pandemic. So this guy just turned to a high risk, and even we have to take a lot of precautions. We closed all the facilities, especially where we have sharing equipment. So we raised the awareness about the importance of stay home for those group of people who think about physical activity as a treatment for them. And this child has even another really new environment. He should study at home, and he should even play at home. In front of him, another really a risk to increase the screen time inside the home. And for this young adult, really, he doesn't have the time, and he lost a lot of accessible services to practice his recreation sport. So this is the situation at the community level, but how about the situation at the public health level? We are really juggling 3 poles. So we are thinking about taking all the precautions for our vulnerable group, and at the same time we are juggling the 3 poles: the pandemic control, preserve the physical health, and preserve the social, psychosocial health for our community. So how we could control the COVID-19 without even making any disturbance to our good effort that we did it in the normal situation. So always when we wear risk, health protection will win any game in front of health promotion, because it has a lot of really implication at the community level. starting from the political agenda, starting from the economic agenda, as well as the psychosocial and physical health agenda. So we couldn't really say anything because the health protection will be very important and very sensitive to think thoroughly about why we should really take care about COVID-19 control for this time, especially. But at the same time, physical activity has a lot of benefits during COVID-19 pandemic. Are we really promoting this? It will improve a lot for the high-risk group, especially those with a chronic condition. If they lost their physical activity, they will be at a great risk even more to get a severe infection. How about people with musculoskeletal condition? And this is what you addressed shortly, Dr. Salman. We are facing a lot of really musculoskeletal problems as a result of the sedentary behavior and losing the activity. How about even the stress management and enhancing the immunity function in our body? So this is really a very crucial, and we should think about how we should promote it during the COVID-19 pandemic. I think even other important issues about how about our activity in physical activity epidemiology. Are we really addressing a lot of questions regarding the link between the physical inactivity and COVID-19 strategies? What is the normal epidemiology and the difference with the epidemiology happened during the lockdown? So do we really monitor the changes? And I'm addressing this because from the Middle East, we need to really promote physical activity in the normal situation, maybe more extensively in comparison to the other region. So with COVID-19, I think we should study the impact of our COVID-19 pandemic control strategy on our efforts to promote physical activity. And how about the intervention? If we really keen to introduce certain intervention, are we studying the impact of these or the effectiveness of these intervention while we are having the lockdown or any restriction of activities during the pandemic control? So I bring some examples. So if we could see some examples, and I start with the impact of pandemic on the Chinese children. If we could consider that the Chinese children, especially those who are living maybe in remote area, they have a lot of really relationship with the active transportation when they go to the school, about having access to active play because of the environment in the small villages or towns. So we could see how their physical activity has been impacted. So the reduction is by 80%. And we could see how the total screen time increased. It's really increased sharply for this group of children for reason or another, for studying at home, or sometimes even for they don't have any choice to do any active play, so the screen will be a solution for them. I will bring even another example from Qatar, and in primary care, we really did a great job to promote the wellness services, and wellness services has two parts: smoking cessation and exercise medicine. So we are having some gyms, swimming pool that could be used for therapeutic reason for those people. We have really promising increase at the start of the first quarter. If you could see in the first 2 2 months in January and February, we have really a good utilization in comparison to the previous 2 years. All of a sudden, we have this sharp decline, and it's almost for exercise zero because we don't have the access. We have to shut down all the gyms and even the exercise group therapy, as well as the swimming pool. The only increase that we have it in starting from May, in June and July, it was about the virtual consultation, and mainly for people who would like to quit smoking. So we address an issue for the quality of life for those people after a long period of losing the access to this service. And this is really, with my colleague in primary care, it would be one of the really area to search what are the impact of losing the service on our patients. But is there any really promising thing during this pandemic? I came across this paper, and it has really some indirect good information for us, and how people are searching for physical activity when they start the lockdown strategy in 3 countries. Your country, Fiona, Australia, and Salman, the United Kingdom, and United States. So we have really sharp increase in searching in Google about the physical activity just after they take a lot of containment measures at the community level in these countries. And we could see, especially in Australia and the United Kingdom, it comes really just almost like searching for TV show. So people, they have some awareness about other alternative solution for physical activity. And this is really promising information for us, that this means that people are aware about importance of physical activity in their life. Home-based program as a strategy has been used by different institutes. And this is also has been used even with our colleagues in physiotherapy. So they really have a balance between the health protection and health promotion. It will at least maintain the minimum level of physical activity, and we couldn't lose what we built during the normal situation. It will minimize the impact of sedentary behavior. And more importantly, it will have some prevention for the psychosocial stress, especially related with the risk and isolation for the pandemic. I brought a good example because I like the name here in this initiative. This is from Netherlands. When they turn the quarantine to quarantine. So this really a group of students in physiotherapy, when they start to share some exercise, how to exercise at home for different age group, and with really updating exercise. So you are like in front of your instructor. And this is really a good meaning for how we shift quarantine to be more active environment. So if I conclude my presentation, I will stress on importance of physical activity, even during this pandemic and even after it. I think after the pandemic, we should really work more extensively to study the effect and to make sure that we put it in any recovery plan for our healthcare system. I think this is a lesson learned, and we have to integrate this physical activity promotion when we tackle any future pandemic similar to what we have it with COVID-19. It's very crucial for us really to learn from this experience and to make it as a priority as in parallel with the health protection priority during the pandemic. Thank you very much, and I could just end my presentation and I will give you the control.
Thank you, Dr. Kuwari. Thank you very much. I guess Dr. Fiona now with us, our second speaker. Dr. Fiona, she's the program manager in the Department of Prevention of Non-Communicable Diseases at the World Health Organization based in Geneva, Switzerland. She leads the WHO's global work on physical inactivity, healthy eating, the prevention of obesity, as well as providing leadership for global monitoring and surveillance of NCDs and their risk factors. Dr. Bull joined WHO in January 2017 after 25 years in applied research in Australia and USA. Her recent positions include Professor of Public Health and Director of the Center for Built Environment and Health at the University of Western Australia, and Professor of Sports Science and Director of National Center of Physical Activity at Loughborough University in the UK. Welcome with me, Dr. Fiona. Here, the screen is yours. Everybody's yours now.
Thank you. Thank you very much to everyone, and thank you to my colleague, Dr. Mohammed Al-Kuwari. Thank you for your presentation. Thank you to Dr. Salman and the organizers for the invitation. This is a very nice occasion. I'm very pleased to join you from Geneva. So I'd like to share my screen. So I will just check that the presentation will come up. I'll seek some confirmation, perhaps, if I may, that you are seeing my full screen, and I will just minimize myself. Can I confirm that you can see my screen, please?
Yes, yes.
Thank you. Thank you very much. Great pleasure to join you, and I'd like to take 15 or so minutes to address this evening's topic, which is the importance of physical activity during COVID. And what I'd like to do is really contextualize that within, of course, the importance of physical activity for our health, for sustainable living, for a sustainable world. And I'm going to draw, and the backdrop is going to be the agenda we have for global work on physical activity. And I thank again Dr. Al-Kuwari for already introducing the Global Action Plan on Physical Activity. If you'll allow me a few moments to set the scene of the importance of physical activity and how that links with COVID, and then to outline for those of you less familiar with the Global Action Plan shown on the screen here, before moving into some of the challenges in my final slides. I'm sure many on this call and joining us via other social media transmissions are well aware of the importance, but just to remind us all that there is an extensive body of evidence now over some 50, 60 years showing a pattern that's shown in this graph, that the more active you are, you reduce your risk of a wide range of conditions which are both prevalent and indeed associated now with being more at risk for COVID and for experiencing more severity of symptoms of COVID. So we have three very clear messages: that any activity is better than none, so we encourage everyone to be active; that there is a recommended range where we have established that there are benefits for everyone being active, adults, children, older adults, patients with chronic disease. And we do know that more is better. And this is just one graph of a variety of these longitudinal cohort studies of different sizes with different outcomes. And it's very much to show you a general picture, a picture that is reinforced on the left in the sorts of publications going back to the Surgeon General's report, the Lancet articles, the global strategy of diet and physical activity, and of course, the global action plan. To bring it very closely and to remind us of some of the core areas where there's very well established evidence, the preventable possibilities of being active against some coronary heart disease, diabetes, colon, breast cancer. And we are hearing, of course, that diabetic patients, those with coronary heart disease, hypertension, are more at risk. Physical activity was important before COVID, and it certainly is now. And we're reminded, of course, by the global Sustainable Development Goals, a very achievable target of 1/3 a reduction in premature mortality, but only if we act, only if we implement the effective interventions. And COVID is drawing attention to the fact we're not acting enough. We haven't put in place evidence-based solutions. We're not acting on the knowledge we know. On the left, I remind everyone that it's not just the target 3.4, that the actions we need actually will have direct and through indirect pathways benefit many of these SDGs, healthy cities, better outcomes and learning in children, more equitable society with more people having access to being active, and of course employment through sport and recreation industry. I mentioned that target, and of course these numbers are familiar to many, but it's that 15 million I draw your attention to, because those deaths are really and truly premature, occurring in the ages of 30 to 70-year-olds, and those that we wish to reduce down as much as possible. And the challenge that we face is that as a society, we're not active and enough. And there are one quarter of adults who don't meet that recommendation you just saw in my earlier slide. And I'll show you some more data about that, because in some countries it's much higher. You see on the right the level of inactivity in adolescence. This is not meeting. So I draw your attention to this is the inactivity, our equivalent to smoking, our equivalent to overweight, obesity. These levels can be reduced. We've done some analysis and it shows what I just referred to, that we are not acting enough on physical activity, and there is hope and there is evidence that COVID is drawing attention and cities and communities are responding. These data show you some estimations and time trend back to 2001 in 160 countries, a harmonized analysis. You see a gender difference, and that is a worry. Women are less active than men. And you see that our net sum progress is flat. And that's why I call for all of us to realize there's a need to implement and prioritize the actions we know can work. For interest, glance at the different categories or groupings of countries here. From left to right, the highest levels of inactivity are in Latin America and Caribbean, where we are seeing, of course, high levels of inactivity, COVID, of course, as they are the epicenter with Brazil, Argentina, and Chile and Peru. This area has got high levels, and look at the gender gap. High income Western, high income Asia. And then you see the pattern across the countries. We can combine and look at each of these category or groupings by trend. You see a lot of flat line. That's where no progress is being made. You see a lot of rising, over time, rising levels of inactivity. Central and Eastern Europe, Latin America, high income. And just in one or two regions, the declining levels where some progress is being made, and very large countries do influence these groupings quite substantially. The most profound, of course, is this summary, where indeed we see in high income countries the changes of how we recreate, the use of technology, how we travel, how we work, which is more computer-based, mechanized, less active. In high-income countries where all of these are more advanced, we see the rising levels, and of course we see trajectories towards that. I've popped in this slide for the audience because it's the region of the Eastern Mediterranean with available data and showing that spread, because of course it's not even. There are countries with high levels of inactivity and COVID, so we know we have a very important agenda to address. This is the EMRO region, but to show it's not just this region that has that wide range, I show Europe here. And this must have been my last presentation because I'm highlighting one country for no particular reason in this presentation, but it's showing you that diversity. It's showing you it's up to 45% in some countries. Almost half of adults are inactive, which is why we have a plan called for by member states, latest science linked to achieving the SDGs, and clear actions that will be important now. A target, which I think many are familiar with, 15% improvement by 2030. And the DG has emphasized the importance. In launching the Global Action Plan, he recognized that it would take political commitment. And we need that political commitment now as COVID responses are tested to how to manage both promoting physical activity and providing the opportunities, ensuring children have sport, recreation and exercise as well as adults, and it will require all sectors to work together. These words were 2 years ago outside of COVID, but now they seem to resonate very much now. This slide summarizes the Global Action Plan, and I won't go into detail, but in each of these areas, it's time for us to work and time for us to seize the need of COVID and the opportunity of COVID to draw together our collective actions. We need to promote being active during COVID, during confinement, during opening up, during the toing and froing and the adjustments, which will be rapid and responding to the situations differently in each country. These again are pre-COVID, but they are the ways we know good communication, clear messages about how to be active. Those countries with these campaigns can of course modify and build on core messages, but we invite countries to initiate campaigns to communicate to the populations about being active, even in the home and through restricted confinement as the context allows. My colleague already mentioned the environment, and of course this has been neglected. It is fair to say there's been a focus on telling people to be active. Now we need to focus on supporting people to be active. And in the Global Action Plan, this is characterized around the environment, creating active environments, which are the spaces and the places that people need, the parks, the walking, the cycleways, the recreation sports facilities, private and public opportunities. Here we have pictures displaying where environments are designed for physical activity through walking and cycling, and where they're made available on the left with the closure of roads to encourage recreation. These can be done temporarily or permanently with pedestrianisation and road closures. And we are seeing through COVID cities responding. I apologise for not having a set of lots of examples of these, but they are available, where cities are responding by creating more cycle lanes, by creating road closures, by providing more public open space through the use of roads and elsewhere to encourage people to be active. Of course, if I may add, we must consider how these may be more permanent changes, because there is an opportunity here to redress some of the urban design that has pushed people out in preference to the cars, even in city centres where we know people define cities, the interactions between people. And so you see the urban design icons below, thinking about it at the planning stage, and of course at the investment and infrastructure and renewal. These are all possible now. The third area is the opportunities to be active. And of course, these have been restricted by COVID. Closures of swimming pools, gyms, clubs, parks. We have less opportunities, and the industry and of course government providing of these programs is challenged in how people can now retain and stay active. We love to see these pictures of young people and of course people of all ages and all abilities being active. We are challenged now in how to provide over the mid and longer term these opportunities in safe and appropriate ways. But there are tools I'll come to. Let me finish with the Global Action Plan fourth area, because it is time to strengthen policy, to strengthen the monitoring and the research that the previous speaker spoke to. And it's this infrastructure of the systems that really support the other areas. And we have got time now to really look at how physical activity has got the surveillance. Do we know enough? And we understand the behaviour in each of your countries. Are we using that data to guide practice and policy, training the workforce on understanding both in health and outside? And of course, there's opportunity now for leadership. And I mentioned those cities who are really showing leadership in this area. There is a call to all work together. Do all of these things relevant to your context and country, your city and your community. But COVID is an unprecedented situation we have experienced for the last 6 months and will continue to experience. WHO has been very busy in this area. We have from the very beginning made sure that physical activity is part of the messages. It is important to stay active, even at home and as we open communities. And these resources are available and being translated to many languages. They can be used as posters, social media tiles, and they're communicating core messages, and they are accessible via the WHO website. In addition, we've been looking at and working with some of the real challenges and noticing that, of course, without the places that many people used to be active, their routines, their regimes have been really impacted. We've been working with the private sector and the sports community in assessing and creating tools to assess the risks and management of reopening. I'll guide you to several websites where not only are there resources for individuals, but also the assessment tools which are helping industry like the gyms and clubs assess how to manage, prepare and reopen when local government and national government restrictions are reduced. We must work together for these solutions, whether it's the city providing temporary cycle lanes or it's the gyms and clubs opening. And in many countries, particularly where I am, in the next couple of weeks, schools were trying to reopen. And so addressing how children will be active and ensuring they can walk to school, cycle to school safely is still important. I've mentioned these partnerships which are working with sport to reopen and provide those opportunities. My last slide is very busy, but it's a contribution to the question and discussion we'll go into. We need to ensure walking and cycling are retained, promoted, encouraged and supported. Temporary and ideally looking for those solutions that could become sustainable and enduring. We can reshape our cities and communities in ways that were better than before. I'm concerned about schools where, of course, there's a priority on the children's safety and teachers and parents, but how will physical education and sport be maintained and provided, and particularly through periods of homeschooling? The parks are reopening in many parts, but we need to make sure that there is this public open space. Many use it as their open gyms, and they are important ways to meet and have experiences outdoors, which is so important for our mental health as well as our physical health. I've mentioned supporting the sector, and I want to draw to my fifth point here, and that is the importance of health professionals. health professionals at all areas, making sure physical activity is recommended, assessing and supporting patients to retain, start, and be active. We have the opportunity, and I think there are many examples from this region and elsewhere, of using digital tools to help people, whether it's yoga, gym, or other home-based activities. We can come out of COVID with more tools to help and promote physical activity. There will be an issue of supporting COVID patients in their recovery and rehabilitation. And I recommend that we need to engage in the research and share best practice as we learn more about how to handle and support. I've mentioned building back better. That's the idea that we can perhaps have some benefits out of this experience that we are going through. The environments, the programs, the tools, the recognition and the support for physical activity. And really, we need to learn from this, whether it's COVID or something similar. There must be some learning that we gain from this. And so I call upon the research community and the institutions that support researchers to ensure we are capturing the impact and then the lessons for the future. So thank you very much for the opportunity to share this work with you, to share and comment, and through questions, share what WHO is doing. And I hand back the floor. Thank you very much.
Thank you very much, Dr. Fiona. It was very interesting. By concluding and before going to the panel, let me just give a bottom line that we need globally to promote physical activity, whether it's during or before or after, for our future, to learn from COVID-19. And I hope to learn positively from it and keep our physical activity promoted globally, all over the world, of course. Thank you very much. And I would like to invite everybody to go to the panel now. The panel with Dr. Salman Rawaf and Dr. Tawfik Khoja. Dr. Salman Rawaf is the president of the Arab Public Health Association, and Dr. Tawfik Khoja is the vice president. Please, I'll join you as well. Please, let's go to the panel. Thank you very much.
Thank you very much indeed, Your Excellency, Dr. Nibal, for excellent session so far. Thank you, Dr. Al-Kuwari.
Thank you.
Was excellent presentation. I enjoyed it. At last one, and certainly not least, Fiona, welcome first, and thank you very much. It's absolutely superb. You put a fantastic frame for us to think about it. I think there are a few questions, and I will go to Professor Khoja shortly. But I think the big challenge here, which we need to discuss share it with the audience, that why on earth preparing for acute event did not take into account eventualities like this. I mean, who have this radio at the background? Is that, I don't know. Anyway, so there is some element of missing link here. Because most of the emergency preparedness is the disease itself rather than the consequences of the disease. How you see that, Dr. Fiona, Dr. Mohammed?
I've got to say, I missed a little bit of your question when you said we had missed something just because of that background noise. Could I invite you to repeat it?
Noise, I don't know where it's coming. But if you look at carefully emergency preparedness or preparing for acute events, I mean, so far, the things coming from many countries around the world that primary care were not included. Now we know you know, eventualities of long-term lockdown were not taken into account. Is it something like a short period of time we deal with situation? Issues like, you know, life for food, life for cooking, life for playing, life for walking, life for schooling. These were not taken into account. So what lesson can we learn from that experience?
Well, I think you summarized it with, we were unprepared. I think as many more eloquent and experienced people have said, there were warning systems. There were those who spoke recently and in the past 5, 6, 10 years that this was a possibility, and we are unprepared. We are unprepared. And it's also exposed the lack of linkages that you also mentioned. We work and we are moving and working in areas which were fine and admirable, but now we realize those links are missing. And so we must work better together. You're obvious there is even non-communicable disease with communicable disease. The underlying risk factors we've heard so much about in the early months are now being labeled. They are diabetes, hypertension, heart disease, overweight and obesity. Research has shown that you're more vulnerable and the symptoms may be more severe. They're not separate worlds, they're connected. Primary healthcare and emergency, social services and medical services. We are being exposed for our neglect of preparation, but learning, and those that are doing well are providing us with ways forward, and the world is sharing those. On physical activity, it has perhaps been a little less visible in the early days, where we dealt with the acute impact as COVID, February, March, April, but now, and we still need more visibility of the importance, because we are into a mid and long term. And I'm sure I share many that it's now been 5 or 6 months of teleworking.
Yeah.
I'm sitting more than I am standing.
Exactly.
I don't commute. I don't walk or cycle because I'm not going to work. My walk to work is 5 steps. So we have to help each other, and we have to change our regimes, even the most active of us. I hand back the floor.
I mean, I totally agree with you. This is applied to me and all of our colleagues now sharing the screens with us, that we are sitting more than we're moving because of the new technology. For the first time in my life, I get a spasm in my back, and my colleagues told me this is postural because you are sitting for such a long period of time. Mohammed, can we address the same question through you, and then I come to Dr. Nibal?
Yes, Dr. Salman, I think it is really obvious for us that we prepare our system to deal with acute emergencies. And even some healthcare system, they underestimate the public health side of outbreak management, because they had the experience of containing small clusters of cases rather than the pandemic, and when it's affect all part of the world. So we are dealing with emergency preparedness as acute condition rather than the long-term condition as we are facing now in the situation. One more thing, I think, even for our experience in the healthcare system, we focus also in the impact of the COVID-19 in terms of the morbidity and mortality now more, even when we are starting to lift some restriction, but we didn't really take in consideration the importance of the indirect impact of this outbreak on NCD patients, especially those with NCD conditions and some vulnerable group, old adult, and even children. I think we have to start to recover this plan. We have the time right now. When we recover any plan, we should really take some alternative for them. There is a lot of awareness about being at risk group for COVID-19, even with lifting restriction, take care. But even we are not promoting the other alternative for the NCD patient care and how we could really find a good alternative to measure the quality of life of those people after they post with a lot of really stressful period of time, lacking of the face-to-face consultation with their health practitioner. At the same time, losing the access to certain services. One of them is like people with the chronic condition, especially in musculoskeletal, how they are now measuring their performance in terms of the quality of life and their situation. If you are a healthy person and you are just suffering from sedentary behavior with this spasm, how about those people with really a chronic musculoskeletal condition? We have to find really other alternatives, even beyond the virtual consultation, taking precautions. I think now it's the time to take the social distancing as a behavior rather than enforcing strategy. Yeah. So people, they should take care about themselves, and at the same time, they should have the access.
Nibal, what do you, as a politician, and I know you are a technical politician, which is more superior terminology, is there any way to address that huge deficit in planning for the future?
Actually, thank you, Dr. Salman, but what I really liked in Dr. Fiona presentation, that she stressed on the changing policy. Changing policy is very important in our countries, especially in the Arab region. When we talked, when the example Dr. Fiona that she gave it in Netherlands or in Switzerland or whatever, that I know, basically I know because I live there. And it's impossible to do it in Palestine, for example, where I am now. So so we need a bigger address to for our change. So we need a policy making changing and plus now to consider the example that Dr. Fiona's gave. So not depending only on the services that we have, because due to the lockdown, everything is under closure. So now we need to reconsider what we have and reconsider the future, because this is a continuous, we don't know the future, what will bring more, but we must had I don't know, we must had in mind a plan B for such a condition. Now it's time to consider this. Plus, I would like to address as well, regardless what everybody have said, the social and psychological aspects of physical activity. That is my concern because it's my specialty. And it's very important to promote physical activity, because we are under pandemic and under lockdown. We got lots of psychological stress, mental health problems, and this we will find it out. We will measure, of course, in the WHO. I guess they measure some of these, but still we are continuing with this. So. All of this together, we can't concern at one issue, but we must collect the whole issues and work on them. Thank you, Dr. Salman.
I thank you very much indeed. I'll come to this point, but let me stand up and move to Professor Khoja and ask him the question in terms of how, Dr. Khoja, I know you are interested in these issues, emergency planning, and you led that in the GCC. You organize many events on emergency planning and how emergency planning should be comprehensive. Did you see the situation improving, and are there any lessons from COVID that the Arab countries can learn from, or even Eastern Mediterranean countries? I know our association is looking at the 22 Arab countries, but we should not ignore the rest of IMRO. Professor Khoja.
Thank you so much. This is first of all, let me express my appreciation to the two eminent speakers. I really enjoyed the two presentations, and it is really an issue we need to address it thoroughly in our public health agenda. What I am trying to let me close my iPhone. Okay. What I am trying to let me answer your question by asking the questions to our colleague, because this is very important to see their views. As we know that physical inactivity is the fourth leading cause of death worldwide, and the prevalence of inactivity in the EMRO around 35 to 86%, and mostly the high prevalence of inactivity in the Gulf region, and with that there is obesity. So do we think that in the Gulf region we need urgently to have a strategic action, like there is a global action for physical activity? What about the Gulf itself? Because we have two issues: the physical inactivity and the obesity is highest in the world. So what modalities we can approach to this issue in the GCC to learn from? So let me ask Dr. Al-Kuwari, then Dr. Fiona. Dr. Kuwari, please.
Thank you very much, Professor Tawfik, about this question. Actually, as I said, it's very important really to measure the impact of the COVID-19 measures on physical activity. And without really good information, you couldn't put the right action for it. I'm afraid about that. Even when we put a recovery plan for our healthcare system, we will forget about physical activity because there are other even priorities. You will put it, and you will start even with the main outcome to focus on certain chronic condition, continuity of care, and then you will think lastly about the importance of having some services related to physical activity promotion. I'm afraid even about that, putting the research agenda really is not a priority during this time, because it's very, very vital for us to get the impact and to put the action. How we could act, there are a lot of possibility, and it depends on the healthcare system and the other sectors collaboration. One of them, I think, the challenge to really get the access to certain services, it should be really managed by more than the healthcare system. And this comes with a lot of really awareness, and depending on the social responsibility of the individuals to take care while they are accessing the service, because you couldn't really live for a long time with these restrictions, especially if you put even some restriction on certain age group that they shouldn't access, or they shouldn't, we shouldn't really recommend them to share the equipment in the gym because you are at this age or you have this chronic condition. So I think this should be a good resilience plan for us in the future. The main concern would be really the activity during the school, because with even opening the school, we will have health protection as the most important agenda. And I think having other solution and alternative for the children by the other sector, it will help even people who are working in the education and the health sector, how they could make the school environment is more protective but you should find other alternative, especially if we found that sometimes some sector in our children, they are getting benefit from physical activity more during the school time, especially when they have the structure play and they have the physical education lessons. So this is really important issue should be addressed. But I'm stressing always about don't miss physical activity promotion in your public health agenda when you recover from COVID-19.
Thank you so much.
Dr. Fiona?
Well, thank you for the question. You're absolutely right, Professor Khoja, to highlight the particular characteristics of the region and the GCC countries. You mentioned the importance of physical activity, along with smoking, along with overweight and obesity. It is a major contributor. Therefore, it's a major opportunity. It's a lever to improve health. Your question is how to respond, and there's a number of issues, and let me just share a number of those. Firstly, I think it's exposing what little capacity the region has, the countries have, for physical activity. So I will challenge the ministries of health and ministries of sports in the GCC countries. Are they working together? Is there anyone on physical activity with a health background in the Ministry of Health? And it would be rare, so I'd be delighted to be introduced to them globally. It may be part of someone's job. We don't actually invest in the area to have the kind of response. We don't have the policy nor the people. I'd also add, I don't think that there has been investment in understanding physical activity as well as we understand other problems, whether it's all the way through to infectious and emergency. Understanding physical activity. I know, because I've worked in your region, I've worked with you and your colleagues, there is very little research on why children are dropping out of physical activity. There's more research on children in your region than there is on adults, older adults, and then other populations. If we don't know the problem and the causes, the motivations, the barriers, the beliefs and the culture, we don't really know what solution. And I can only share with you that one of the very important building blocks to other countries, notably Europe and elsewhere, is really understanding, and then solutions can be tailored. I think we all appreciate how difficult it is to change eating patterns, to change smoking patterns, to change any of our patterns. So you need to understand what drives the behavior and where and how to help people change. But this leads to another opportunity then, and that is, I think, that people are receptive to change. And Dr. Nibal, you mentioned mental health and people's social health. We are missing connections with people and family. Exactly. And the social environment, but we're also experiencing a great deal of stress and uncertainty, financial and with our friends and family and personally. So change and the role of physical activity could be presented as solutions in this. And I really liked Dr. Al-Kuwari, as you mentioned, the schools will focus on health protection, and we should be protecting the child's health and the child's mental health. And you know how important physical activity is for schools. So we must make sure it's not neglected in favor for the other subjects. We must work out how to do safe, socially distanced ways children can be active. It's as important as maths and English and science, not to be crossed off as schools adjust. So there's more research to understand now and going forward, to inform. Let's invest wisely. These are not large problems. This isn't saying we need research for the next 3 years before we can have a solution. We're talking about doing rapid research Just like they do in, we could relabel it and call it social marketing. In 3-4 weeks, we'd know main issues if we invested in finding them. I apologize. Let me hand back the floor.
No. What I'm saying, you're not talking about academic research. What we need is actually some service research, you know, to look at the needs and how we address it. But let me pull this question a little bit further. I think what COVID, and from all the presentation and discussion so far, showed us in relation to physical activities and being normal people, you know, without obesity, without chronic diseases, without this, without that, is really the poor urban planning. And if you look at the slums in many parts of the Arab world, the dense communities without any consideration, especially high-rising building, no spaces for the children to play. Look at the state of the school, how miserable they are in many places. Not enough capacity for children to play, overcrowded classes, you know. Look at the pollution that our children are exposed. I mean, all this is because we don't have urban designer. We don't have really people with mentality and imagination and innovation to create the city away from focusing on facade and on monuments and this so-called beauties, etc. I mean, we need the practical cities. Nibal, I mean, you are part of the big planning process. How do you see if I say that in Ramallah, you know, a beautiful place, but missing all the ingredient for people to move freely and do
absolutely. Absolutely, it is like not only in Ramallah, like in the whole Palestine, let's say, because building, as you said, buildings, stones, and they are forgetting to create an environment for physical activity. They are forgetting to create an environment for children. They are forgetting to just thinking economically. And this is a disaster. I'm sorry to say this, and that's why Dr. Fiona said we need to change the policy in every country. In every country, there must be a policy regarding the 4 points that you have said. One of them is to create an environment, since the services are not there. And by the way, the services are not accessible for everybody in here. Like services is for people who have money. So now, since the services are also under closure, then what's next if we don't have an environment for such an activity? And so we need, again, Dr. Salman, not only in my country, of course, in many countries, to think about our future with or without pandemic.
I mean, I love to see people cycling in the cities of such as
exactly,
such as Jerusalem, such as actually Cairo. You know,
actually I do, but I am very rare there.
Yeah. May I comment that indeed you're absolutely right to point back and draw us back to the policy, because it shows the priority. And, you know, the expression that we have forgotten is because we've reprioritized. We've prioritized parking over parks.
Yeah.
We've prioritized the speed of cars traveling from A to B, which is absolutely the antithesis of the slower, more integrated, closer. Speed stops cycling. Speed stops walking. And so speed creates the atmosphere and the noise and the air pollution. It's going to challenge some very central things for the region, and that is that the cities were for people and the modes of transport we want to prioritize. And so it calls for policy, but regulation. It must provide. And those photos that seem to come from Europe, I'm very encouraged. I'm seeing more in Asia. I'm seeing more in Africa. I'm seeing more across Latin America. It can be done, when the priority and the political will sets the regulations. You must provide these facilities. If children don't do it now, they'll not do it as an adult. So I think many of us might remember playing sport, walking in the neighborhood, cycling, but that's not the experience we are enabling in generations, and too many generations now. So I'd invite us to think about the bringing back of political prioritization, but this is a win-win. And I draw your attention to that circle of the SDGs. Yeah. This same conversation could be about reducing road deaths because they're walking and cycling. The vulnerable users are largely, certainly more in Africa, and I would have to look in your region. It's about healthier cities that we all want. It's about climate change and less pollution. So these same solutions, policy solutions, will deliver win-win-win. More activity, more community spirits, more interaction, and actually more economic benefits, because we're saving in health, and then we're saving in other ways of the sustainable environment. And we invite you to nuance that argument, to put the political spin on this. The science backs you up.
It's the people who shape politician ideas to change. I mean, people bring to the attention of our politician what is needed and how this priority shaped. Professor Khoja?
Thank you so much, Professor Salman. You are very nicely leading this seminar, webinar. I would like to say that during the preparation of this webinar, I read a recent article published in the American Journal for Physiology and Heart Circulation Physiology, just last month, 2020. And they came out to the conclusion that social isolation during COVID-19 increased the physical inactivity and increased the burden of cardiovascular disease. As I am, or you are, and we have a lot of now decision makers listening to us, what is the module available? Evidence-based module that WHO can advise our colleague in the ministries of health to be applied, especially with the scarce of resources, and the resources move to COVID-19 rather than to any other health promotion, health prevention. So is there any module that can be applied with which is cost effective, which is practical, and can be applied at a national base rather than on individual side? Because I was looking for such things, I could not find a real module. Maybe I don't have a very well exposure in this area, so I need Professor Fiona and Dr. Mohammed, if they have experience in this regard. Thank you so much.
Yes, Professor Tawfik, I think this is really a good question, because it's really highlighting the dilemma of vulnerable group and different strategies in the two pandemic. So I'm really raised this question multiple times about what are the alternative for those people who are getting the benefit from being active for their chronic condition. And based on my search, really, I couldn't really find anything except some stay or home-based exercise, which is really promoted for certain group of people with a lot of virtual follow-up, I think, by their healthcare provider. But the main challenge will be different from one healthcare system to another, and the situation of the COVID-19 pandemic. In certain countries, even with good capacity, they were stretched with the load of the cases, especially in the past 2 months. So I think the concentration on the intensive care and even taking care about the COVID-19 management was the priority. But apart from what I mentioned, I couldn't really find anything. I think Professor Paul, she could elaborate more.
Thank you. If I understood your question, if I heard it correctly, it's about solutions. Is that correct? So, and priorities. I think I concur with my fellow speaker that there are context specific. So there is no single magic bullet here. But I think appraising the situation, and if we prioritize those where there is a large risk and therefore large gain, I would have to point at least to a priority area of promoting physical activity and addressing those who are overweight and obese and diabetic patients. And you may have seen that even in the UK, there's now been a recognition of the importance of overweight and obesity. This has been talked about for 25 years. Policies have sat on shelves, but now we have the Prime Minister saying we must address overweight and obesity. And I think we can see there's been some connection there, perhaps his own health and his experience of COVID. He's recognizing now that connection that we can address. I would invite, knowing some of the epidemiology of your region, that I know you have a priority around the diabetes, overweight and obesity. So let us think about those individuals and how to help and reach them. They may be least likely to be active. They may want home-based. They may like the digital solutions. We'll need to find the right things, but they need support. And that's where the medical professions, the health workers, they need support not to be encouraged to try, but then supported over a number of weeks, because it is weeks and in short encouragement. So 3-month programs, and you have examples I'm aware of in response to COVID, but I think we need to scale them. You need to target the men. You need to target women. You need to create a momentum and movement with the leaders, whether they're political, social, the artists, the young people. So we need to pull all on our capabilities and knowledge from economics, behavior change, psychology, public health, and behavior change, but target it. Otherwise, we are just throwing out solutions a little bit too much. We mentioned youth, and that's a target. And I draw attention to perhaps some middle-aged, high-risk patients or those at risk of diabetes.
Thank you so much. Thank you. Great. Thank you.
Dr. Tawfik, I just really encourage to use even simple solution. One of them, based on our experience, is using the physical activity vital sign in our EMR. I think this one will help us a lot, especially as a healthcare provider, to just remind people after COVID-19 about the importance of physical activity. Once you take the vital sign about anything, all the vital sign, one of them is the physical activity. It's a simple question that will keep you alert about those people who are inactive, those people who needs to be counseled during your comprehensive management for any given condition. And at the same time, it will just make the patient or even the person who's using our health services aware about something missed in their life. So I think this is a simple solution that we could even integrate it, and I encourage even to use it systematically when we have any any type of the EMR used in hospitals or primary care.
Can I build on that? Because I think you're absolutely right that by asking is very important. And one of the important elements is the assessment. And so many people I have a regular watch that tells me the time, but many people have a watch that tell them lots of other bits of information, which is how active they are. And whether it's a pedometer, a watch, or any other device, I think people have shown time after time, they are surprised when they see their level of activity. And I'm talking about the populations we're talking about. They think it's wrong. They think there must be a mistake. I'm sure, Dr. Al-Kuwari, you have seen this also in your initiatives, where adults will measure over the days and be very surprised. But the campaigns that you can do, whether they are a number of steps or increase your steps and reinforce that, they are tested and can be very valuable tools that are being used around the world. So they may be part of the suite, the campaign, the policy, the measuring by vital signs and assessment and counselling, and then tools like these, and they're getting a lot cheaper than they were 10 years ago.
Shall I extend in this issue, if you don't mind, your respected colleague, my respected colleague, the issue of telemedicine, telecommunication. I saw in the UK, when I was in UK, that you managed chronic illnesses like bronchial asthma, diabetes through telecommunication. How effective is, if we can ask that the GCC Ministry of Health, they apply the using of telecommunication as a module to monitor the diabetic, the overweight, the obesity, and to encourage them and to put what is called a performance indicator. Is it effective? Is there any similar in the world like this example?
Well, I think it's a very good question. I don't want to preempt, as it's not an area I'm prepared and ready to provide that answer to, but I would invite that my colleagues at WHO would be delighted to speak and discuss the role of telemedicine and the effectiveness of that. So, of course, I'm based in the Department of Health Promotion, and my colleagues are based in and deal exactly with this in terms of e-health and mobile health and providing ongoing care to chronic disease patients, and as well as primary prevention. So let us note that this would be a good opportunity to explore in more detail.
Thank you so much. Thank you so much. Dr. Kuwari, do you have any example in your country? You are advanced in using the IT.
Yeah, I think for using the tools to enhance your physical activity, it shows some really good effectiveness, and especially with certain group of people. I could mention that people above 45, they are really concerned about their physical activity, especially if it is related to managing some chronic condition. What it just need is to have a healthcare provider who stress on the importance of monitoring yourself. And I think that the only concern is about the sedentary behavior. I'm a little bit concerned about our way to promote physical activity in our Arab countries. Okay, one of them is we are talking a lot about importance of sports over the physical activity. In my example, I put physical activity has different meaning to different segment in our community. Other thing is about the sedentary behavior. I will focus on sedentary behavior.
I think we could continue with this subject forever. I know it's very interesting. Despite I got a spasm and my interest has become even more serious. We got a lot of questions actually. There is a group of questions quite similar about schools and the missed opportunity by closing school in terms of how much that will affect the next generation. Unfortunately, we don't have time to answer all, what I have 1 minute to say thank you. And there are comments from Al-Ghafari, from Samir, from others, all talking about the missed opportunity in preparing for acute event. And I think this was the focus at the start of the questions. At the end, the last 30 seconds I have just to say how grateful I am, Fiona, and a pleasure meeting you. I know you for years, but it's a pleasure meeting you today with us here. My dearest brother, Dr. Mohammed Al-Kuwari, we are always proud of you. And of course, our star today from Palestine, Her Excellency Dr. Nibal. It's a pleasure meeting you. On behalf of Dr. Tawfik Khoja, the entire membership of the Arab Public Health Association and its executive, I thank you all for joining us today. It was excellent webinar. And next week, we are talking about COVID and cancer services, a very important topic with some prominent colleagues joining us. Thank you very much, and good evening, good morning, good afternoon. Bye-bye.
Thank you.
Thank you.
Thank you.